Oh, I
Okay.
see it. Oh, there we go. We're on.
Okay. Welcome to everybody. It is absolutely exciting and such a privilege for me to be able to host this panel discussion. And we have two amazing trailblazers, Bitten Johnson, that I think all of you who've been following Nutrition Network know and love well, and Dr. Lori Calabresi. She's an MD, a psychiatrist. And I'm just so excited to be discussing a topic that has caused so much anguish, when the solution can be as simple as changing your nutrition. So let me start by introducing Dr. Calabresi. She is a psychiatrist with a focus on holistic mental health, and she emphasizes the integration of mind, body, spirit approaches in her practice. She combines traditional psychiatric treatments with lifestyle interventions and complementary therapies. And she's known for her compassionate and personalized approach to patient care, aiming to address the root causes of mental health issues to promote lasting wellness. Welcome, Dr. Calabresi.
Thank you. It's a pleasure to be here.
And Bitten Johnson, our addiction specialist extraordinaire. Bitten, as all of you know, is a registered nurse. If you don't know Bitten, look her up. She's a renowned expert in sugar addiction. Yes, sugar addiction is a disease. With a career spanning over 3 decades, Bitten has dedicated herself to helping individuals overcome sugar dependency and reclaim their health. Through her work, Bitten emphasizes the importance of understanding the physiological and psychological aspects of sugar addiction, offering practical strategies for long-term recovery. She's a passionate advocate for education and awareness around sugar's impact on health and well-being. Welcome, Bitten.
Thank you.
Always a pleasure to have you on any of our panels. So, as you know, if you're watching this, we are about to launch metabolic psychiatry module called Metabolism and the Mind. It's a cutting-edge field. It focused around the essential role of metabolism in mental health. Metabolism and the Mind is a training that equips healthcare practitioners with an understanding of the intricate relationship between the metabolic processes and their mental health, enabling more effective treatment and support for mental disorders. So sign up to enroll before the 26th of June, and you'll be able to take advantage of our 20% early bird discount that's running. You'll see the enrollment link in the description. So this is a topic that it's seeing epidemic proportions around the world. The topic of anxiety and depression, and we are just inundated. I've seen in my own practice people coming in, and more often than not, almost if you were betting almost 100% of people have suffered from anxiety. A large proportion of those patients are on therapy for anxiety that I see in my practice. And as an integrative practitioner myself, I focus on the role holistic health, the role of, environment and trauma and experiences and somatic therapies, as well as nutrition. So now it's so exciting that we're looking at the role of metabolism and how this can completely change whole lives, families, dynamics. So I'm going to start with Bitten. So we're going to start just each of you just describing and sharing a little bit of what your lecture is about to anybody who's watching and who's interested in, can what we eat actually impact how we feel, how we behave? Bitten, what are you teaching us in your lecture?
Yeah, I like to give a brief history too. I talk about my own experience as a teenager, waking up many mornings feeling very depressed, very low, very moody. Nothing was fun. I didn't want to go to school. And they all talked about hormones and teenager. And, and then I went to school because my parents pushed me. You could only stay home if you were deadly sick. And that was good because once I got going, having breakfast, it disappeared. So I was baffled by this. But it was when I binged on sweet the day after, I understood that many years later. So that was my first connection with understanding that sugar and carbs play havoc with your body and mind. It wasn't only my stomach or so. So when I came into working with alcoholism, I heard about, Alcoholics Anonymous, AA, and the founder of that, his name was Bill. Early on, he met Abraham Hoffer. Abraham Hoffer was the first orthomolecular medicine doctor from Canada, and he was trained by Linus Pauling, who got the Nobel Prize, with C vitamin. So Bill had severe depressions and severe insomnia. And I mean, he was in a program for his alcoholism and all that, but it didn't help. So Dr. Hoffer put him on B3 niacin, huge doses, and C vitamin, and his depression lifted. And I heard that story early. So that was the first, because when I came into the field, it was only talk therapy. And it was only, you were an addict, any outlet, because of a trauma. And what I found out, that wasn't true. People were addicts before a trauma. And the trauma was, of course, making it worse. But, the addiction was there early. So I thought, this is not right. So then finally, I learned that addiction is a primary illness. You could have several things with it. But that's how I started. And then I met people from orthomolecular medicine and integrative functional medicine. And I got this, that it is a brain illness, but it is physical, psychological, social, and spiritual consequences. So that's the holistic approach. So we all three work with holistic approach. So I realized if somebody going to recover, you have to give them recovery tools in all those 4 areas. And, what I see today is that many people put the wagon in front of the horse. They work with the consequences instead of the core issue, which is healing the addiction, healing the brain. And then, of course, many things will go away and people restore energy. Because one of the things that I think is so profound with the ketogenic diet is that it restores mitochondria. It restores the powerhouse, the energy house. And so many people have come to me and said, I'm so depressed. I have so much anxiety. But, when I look at the symptoms for volatile blood sugar, that's what they have. So once you start pinpointing and teaching clients about that, it's amazing how they start understanding that. I ask them, this sounds silly, but are you really depressed? Or do you have loss of energy on a cellular level? And those people never heard medical language, but they look at me like, what did you say? Say that again. And I repeat it, and something clicks in them. And they said, yeah, you're right. I have no energy. That's why nothing is fun. That's why I feel depressed. So to start from that level, because if you don't, remove the toxic food, if you don't heal their brain, if you don't give them the energy back, they will never get a hand on how to live their life. So that's, I could say, the key issue in how I'm working.
Right. So obviously in your talk, that's what you teach, that there
I
is...
teach that, yes.
You teach to recognize and to score or to basically diagnose whether somebody is sugar addicted or not, because it's a very different approach if it's related to sugar.
Absolutely. So it's sugar and carbs, of course, but people respond. If I say, are you a food addict? People say, no, I don't have a problem with food. And they think, fish or meat or egg or whatever.
Well, they would be right because they don't have a problem with food.
No, exactly. So that's why I know most of my colleagues say food addiction, but I keep being, stubborn and say sugar addiction because I'm a clinician. I meet clients. So I said, but what about sugar? And they said, oh, yeah. Then it clicks. And then we can start talking about sugars and flours and carbs and blah, 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 blah. So that's how I reach them. That's how they wake up. So that's why I do that. And so I like to teach them about, insulin, metabolic dysfunction. I like to teach them about the brain is one of the organs in the body. So the brain needs as much nourishment as the stomach and the nails and the toes and blah, blah, blah. And that was one of the things I realized growing up. I used to work at the highest specialized hospital in Sweden, the Karolinska Institute. And we were so highly specialized. So the kidney doctor couldn't spell to heart, and the heart doctor couldn't spell to kidney. And I saw that early as a huge problem. They didn't communicate. So, it's very good that we have highly specialized people. Fine. Yeah. But if you don't understand that everything is connected to everything, and this, because clients said to me, do you think my symptoms could be from that? Or they said that to a doctor and they said, no. Food has nothing to do with it. And that's what they heard all along. And they, stumble out of there feeling very sad because nobody listened to them. Yeah. So that's one of the problems I've seen. And another thing, that's why I love when I found Nutrition Network, because you are the forerunners in this field. That, science today, at least here in Sweden, we are in the dark ages. Nobody can spell to keto over here in the medical field, I promise you. You'd be shocked if you were here because it's so dangerous. But the thing is that somewhere I read that it takes 17 years for modern science to get into clinical world. I would say 30. I would say 30. That is so scary. So we are in a really high bind here between the old and the new. So clients come, they have hope. They want to learn about biochemical repair. They want to learn about, is there supplements I can support my body with? Because of course, food is the best medicine. So that's where we start. I use other tools like breathing. I use sleep improvement. I use a lot of other tools. So, to restore the body. And they need to understand that everything is connected to everything. And, what you do for your body will heal your brain. And what you do for your brain will heal your body. So
absolutely.
I think that's a very important point. And there are so many simple tools today that we can use that the clients, I teach clients breathing techniques in 4 minutes.
That has a whole body effect, not
the
just
whole body. Exactly. So, and I think so many people I've met so many depressed, sad, anxiety-ridden people that think that they are failures because they didn't respond to the pills, to the antidepressants. Nothing happened. I don't mean it helps if some people, but not as much as they get here. They, I've gotten so many advice and talk therapy, talk about the childhood. And I met so many anorexics. I look forward to your experience, Lori. So many anorexics that were sugar addicts in the bottom, but they blame the mother. It was so horrible in the old days. It was always the mother's fault that somebody was anorectic. I've seen horrible things happening in that way within the psychiatric ward because they don't have all the pieces in the puzzle.
Right.
I'm so happy that we connect the dots.
It brings it to root cause, and exactly what you said, Bitten, that there's so many specialists and they don't talk. And I think that's the problem in the modern world. It's a perfect time to bring in Dr. Lori Calabresi. So, I mean, you're a traditionally trained psychiatrist, prescribing pills and doing talk therapy, and then something shifts for you that brings you to this point. And I mean, I know that you've giving lectures all over the world in your field. And could you share with us? I mean, we had a meeting where you shared this moment for you and what changed and brought you to this. So would you like to share with our viewers so they have an idea of what brought you to this point of holistic therapy?
I'd be happy to. Thank you. I think the way to frame it is to really say that I have always wanted to be on the cutting edge, do the right thing, like know what the science is. And throughout the course of my career, I did that traditionally, just like everybody else did in psychiatry. And then I realized that I was somehow no longer on the cutting edge, and that medicine was no longer on the cutting edge, and that the new pills were always like the old pills.
Yeah.
And I started branching out into looking at where the science was shifting because somehow I missed that. Somehow I missed the scientific shift, busy with family and taking care of other things. And as I was looking at all the new science, a patient came to me referred by her aunt. She was a young woman with severe anorexia, severe chronic anorexia. She was almost 30. She'd had it for half her life. It had really changed her life in such a negative way. And by the time she came to me, her aunt had said, "We found you because we've been looking and you write about things on your website, on your blog that other people don't write about." She started a ketogenic diet. And I got really excited because I thought this is really neat because she needs, boy, as an anorexic, she needs healthy fat. She needs a series of proteins to really rebuild dendritic growth. And her aunt brought her to me saying, "She's been doing this, she's better, but you have something else that you could add to it," which was ketamine treatment at the time. I was the doctor who added the ketamine into her ketogenic diet, and she went into remission, complete remission from anorexia after the third treatment. I had never seen that before, never. And when she called me and said, "My anorexia is gone, I'm no longer thinking about food," I said, "Oh, oh, I'd never heard that before, never seen that." And she actually stayed in remission. She had a total of 4 treatments. She stayed in remission. And later, her aunt called me back and said, "She's doing well. She's really doing well. Is this a one-off? Is this like, let's write this up? We've never seen it." It turned out COVID happened in the meantime. We wrote it up. We got the case report published, and then we decided to see if we could replicate this. If there was, because we didn't know, was it the ketogenic diet? How much of a ketogenic diet? What is the ketogenic diet that we would use? Do you need both parts? Is it just the one part? So to start with, and as a clinician in an office, even though I come from like wonderful hallowed halls in academia, I treat patients every day. That's what I do tonight. I treat patients every day, all day, too many days. And so and it was a big deal to get an IRB, create a study, get it. We recruited 5 women and support partners. And in the middle of COVID, with masks on, we lived with them for a weekend and got them into ketosis safely. They were weight restored women with anorexia, but got them into ketosis very safely by the end of that weekend. And then continued a ketogenic diet for them, looking at specifically whether or not their anxiety, obsessive symptoms, compulsive worries, whether their eating could actually stay improved. This is a big deal. It's a big deal. What appealed to the women with anorexia is that we said, we don't want you to gain weight. Actually, our goal is not secretly to make you gain weight, to get fat, you're already partially weight restored and you struggle. Our goal is to turn off all of the stuff in your head and give you back free headspace. What would you do if you had free headspace that wasn't consumed by food or putting sugar on your broccoli when you could sneak it in, or doing all of these other things? Like, what would your life be like? So these 5 women continued a ketogenic diet. And what was interesting is we said, we'll give you a choice because we don't know the answer to this. You could do it for 4 weeks or you could do it for 8 weeks. And then you could make a decision about whether or not you went on to ketamine treatment. The long story is they all got better. And they got better to the point that their eating disorder symptom scales normalized to the point that they were indistinguishable from women without eating disorders. We went on to publish that, as a case series amidst a lot of tomatoes. And when I mean tomatoes, I mean real tomatoes from all kinds of email from the eating disorder community that said, this is dangerous. You're not an eating disorder specialist. Like, what are you doing? What are
Yeah.
you doing? And I thought, you know what I'm doing? I'm really looking. I'm really looking and listening and trying to figure out and trying to translate the science. And
Right.
as I started doing that, I realized in the rest of my practice, what was better for these women was their mood, their attitude, their cognition, their anxiety was dramatically relieved. And I thought, I should start seeing if this is true in the rest of my practice. I should do that. Who's doing this? And not a lot of people were doing this, right? So that's what started my own sort of real journey with a deep dive into metabolic health and a deep dive into being committed to trying to understand the connection between metabolic health and mental health in what I see. And what I see is a mess. I see a lot of anxiety. I see a lot of depression. I see people with complex comorbidity, with lots of different things, because that's what there is now in psychiatry. A lot of easy stuff is done maybe in primary care. And when things don't work, when there's so much treatment resistance, when the drugs don't help, when the therapy is tiresome, when the symptoms come back, oftentimes patients will find their way to a psychiatrist. And what we want to be able to do is to offer them remission, right? Ultimately, I don't want to just help. I do want to help. I should say, I do want to help. But really, what I would like to do is to get people back to their best selves, to their best selves. So that's what prompted the real, my real deep dive into offering ketogenic metabolic therapy in my practice as a metabolic psychiatry practice. But that meant pulling in experts to work with me, figuring
Right.
that out, and then it's brought me to this place.
So I just want to mention that Dr. Laurie's talk for the module is ketogenic diet for depression and anxiety disorders. But this was just something I had to bring up because anyone who has dealt with a patient with an eating disorder from my perspective as an internist, from a generalist, from any point of view, knows how devastating. Even my colleagues co-managing, my psychiatric colleagues, when we co-managed patients with the medical complications of these eating disorders. So we're talking about people requiring admission to ICU whose cardiac muscle has just now shrunk because they're burning muscle, they're breaking down their own muscle tissue, they've got no body fat, and they simply, it's not that they don't want to eat, they simply cannot eat. It is a devastating disease. To have a situation where you can give life back to that patient, as you say, we're all clinicians, and around that one patient is an entire family. There's an entire community, and changing that one life can bring life back to that whole family. And the opposite is true, that so many patients that we see with diseases, mental health diseases, addiction diseases, there is a long history of a family member who was not treated adequately. So that's the reason. But obviously, your talk is about ketogenic diet for depression and anxiety disorders. I just wanted to reiterate that. But coming back to you, Bitten, so we're talking about sugar, and sugar addiction starts early. Or we were talking to you, and one of my bugbears as a mother of two, I've got a 9-year-old and a 12-year-old, and we're a sugar-free house, and that's the way it's been for most of my children's lives. We're starting to introduce sugar too early and driving this disease. Is there anything that you want to talk about in terms of, you said it happened in adolescence. Adolescence is one of the times that is such a high risk factor for metabolic disorders that people don't know the metabolic milieu and hormonal milieu changes. What thoughts do you have around how we're living with our children and driving this?
I decided early that I would not specifically treat children because,
Right.
you know, most of the clients that came to me had children under 12. And, you know, and even under 18, it's very hard to motivate because of the prefrontal cortex is not matured enough. So, you know, they need role models. And one of the most amazing things I did once, I was lecturing for 13 to 16 years old. And, you know, they were totally unconcentrated and rowdy because they thought that I would stand there and show pictures of sugar, of Coca-Cola and, you know, da 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 da. I started to talk about the brain and energy, and the whole auditorium got deadly quiet. So I realized that's a way to reach them in the teenage years. But when it comes to small children, I think that parents has to be role models big time. A lot of people ask for help. How do I get my kid to not love sugar? Well, do you eat sugar? Do you have sugar in the house? Yeah, you know, we do. Well, I think, you know, a good way is to start eating better, to start improving your own eating and, you know, have them follow you and not talk about weight. This makes you fat, this makes you slim, this blah blah blah. What I see, the way it works is if parents talk about this will give me more energy to be aware of what's going on around me and be able to play and to be able to be good at work and talk about energy. Don't
Right.
talk weight and symptoms. When, you know, sugar addiction is, I see it as the most devastating illness due to the fact that it is such early exposure. Even as an infant, you know, with formula.
Or even before, when the mother is just cycling it through
Of
in
course, you know,
her.
mother is eating all the sugar, and a lot of mothers say, "Oh, I'm going to be fat from the being pregnant, so I might as well eat what I want." If you're an addict, that's the way you think. That's a crazy way, yeah. So, you know, it starts way too early. And then, you know, not every kid will be addicted, of course, but the one that is. And one thing I see too is that we don't restrict it when they're kids. We laugh at it. Oh, it's a sugar rat, you know, she likes sugar and she doesn't like meat or fish. She likes white food. That's a word I hear a lot here. So, but that will, you know, kickstart the reptilian brain, the eating instinct into going into overdrive. So now you have the reward system, you have the reptilian brain saying, if I don't get it, I die. Well, it's not that obvious, but you know, the feeling is there. And then you have the insulin, hyperinsulinemia. So now you already have a body that is going in high drive. And once that happens, parents have a very hard time dealing with that child. And the interesting thing is like with, you know, different drug outlets, some kids will be very sedated. Nothing is fun. They don't want to move. They don't want to go to school. They want to be at home with the screen, you know, watching TV. Other kids will be hyperactive. So you can get both reactions from the same poor nutrition. But I think awareness and
Yeah.
what I don't see, we are trying to start that in Sweden, but what I would like to see is groups, parents supporting each other. I think parents have a lot of shame that they can't control their kids' eating, so they don't want to talk about it. But I think that's one of the ways we have to go. Share how difficult it is in this, because you look around you, it is constant exposure. Early exposure, constant exposure. Here I see young people, you know, that doesn't look healthy at all. And it is, you know, sweets and energy drinks
But I
all
think
the time.
what you brought up is so important. One point you actually brought up, which just it hit me here, was that feeling of I'm going to die if I don't get it. I'm going to
Right.
die,
Yeah.
right?
Yeah.
And we're exposing our children. I always have this kind of, and I speak about this. in our country, you have to enroll your kids even while you're pregnant. You have to enroll them in the best schools to make sure that they get their place. And so you're doing that and taking your vitamins and you're doing all this stuff and going for your scans. And then this baby pops up and you've got the beautiful nursery and everything's perfect. And then the sugar starts. And I think that if people had awareness that this was not the best future, present, whatever, or future for your child. And that what you just said is when they are detoxing or coming out of it, it's literally like being on a drug where the brain is feeling like I'm going to die. And if we have that situation where parents are feeling, I'm going to die if you don't stop shouting, so I'll just give you the thing because it's across the board.
You know what, Hasina, we look at generations back, they love their sugar, the grandparents and everybody, and it is, rewarding to give it. So even if the parents, start doing this, there is a long line of people, at least here, to bake the cinnamon rolls and buy the chocolate and buy the candy because grandma wants to be nice. So we have all this. So parents today, they work, they take care of their kids, they do as best they can, but they can't always handle that pressure, so it's permeated, it's in the whole society, the way we look at this with sugar. So we need more awareness how dangerous it is and how it ruins the brain. And that is one of the things that is very important for us, to lift the awareness of these things, I think.
Absolutely. Dr. Laurie, in your practice, can you give us an example of a patient who comes in? Now, any people with a background in psychiatry, or psychiatrists watching, or just medical practitioners, any practitioners know that the pills get changed or they increase, and then come the side effects. We all know that most of the antipsychotics, the antidepressants, the antidepressants more stimulate weight gain. And when somebody is on an antidepressant, it's very difficult to get that person who is wanting to be metabolically healthy to lose weight no matter what you do. And I've had a lot of experience in this. So can you give us a scenario of, traditionally, like how traditional practice would treat this person and versus the person coming onto a ketogenic diet, and what you've seen in terms of treating these clients or these patients with nutrition and holistic therapy?
Yes, I'd be happy to. I think one of the things to be aware of is when a new patient comes into a practice, or a patient that you're treating for a while, the first thing to assess is really whether or not there are still symptoms that need to be treated. Many of the patients that we see, whether they're new or ongoing, are still symptomatic. So they're better on what they're taking. They're compliant with it because it is helping them in some way to be better, but they're not fully well. So they have both continued symptoms. It might be anxiety, it might be panic attacks a couple of times a month, it might be a little degree of obsessive thinking, it might be that sleep is still disrupted, and they may be on a medicine or two or more, and they're looking to feel better. So the question then is, what do we do? We have an array of things that we can offer in psychiatry. We have an array of things that we can offer in medicine, from additional psychotherapy, different psychotherapy, psychotherapeutic techniques, to a change in medicine. Maybe we augment, maybe we add another one, maybe we switch, to an intervention, maybe ECT, maybe ketamine, maybe transcranial magnetic stimulation, lifestyle changes, maybe mindfulness, maybe meditation. So we can offer all these things. In traditional psychiatry, the last thing that's usually thought about is nutrition and changing your actual lifestyle. We've only now begun to say, try to protect your sleep, try to improve your sleep hygiene, but very often doctors don't even begin to touch the question of food and what you're really eating, what someone is really eating. I think it is critical that we know that that's an intervention now that we've seen in serious mental illness, and the the evidence is rising, and in forms of, psychiatric disorders like depression and anxiety and eating disorders, where the evidence is emerging, where that can play a pivotal role, and where nutrition can actually be essential in terms of being an option that we offer, right? The question is, how do you offer it? So it's very easy for a doctor to say, let me add this or that, or switch you. Here's my little prescription. I'm going to write it out. Try it. Let's talk in 2 weeks. When you think about beginning the conversation about, could you imagine that if we could do something, if I could give you something, Hasina, that would improve your energy, get you sleeping better, make you think sharper, get your anxiety down. What if I could get you something or give you something that would make you clear, make you focused, help you meet your deadlines? What if you lose 30 pounds, 10% of your body fat, get your sugar under control, and like, would you take that?
Sign me up now, Doc.
Sign me up for that. And then what we can say is, we have that already. It's actually called a ketogenic metabolic therapy, or a ketogenic diet. And I'm clear about, when I offer that to patients, that I don't say just low carb or low sugar, because there are additional benefits, really additional benefits that are on a cellular level that come from being in ketosis. And what I talk to patients about is, we could do this, you could do this, we can help you, we can help it be really successful, and we can meticulously follow things so that as it becomes easy for you, you see the changes, you see them qualitatively, your family sees them, and we measure them with rating scales to kind of show you. That's how we got the data that we got for the paper that we just recently published, looking at complete remission in anxiety and depression. But what I found, surprisingly, I'll just add this as a little thing, is that patients really want the education. So we thought, you know what, we're going to do a book club for our patients. So now we have a book club that they come to, that they like read the books on. We thought, we have to, like Bitten was saying, we have to model. So now from the beginning, actually, but now it's sort of gotten bigger and bigger. We walk 4 times a week with our patients. They are shocked to see me like in, jeans or leggings walking around. Rachel, my dietitian, would sort of like half an hour here, half an hour there. Just join us. Come out, talk. It's created a community. They feel like now they just know by first name other people who are on the same journey, no matter what brings them to that journey, whether it is a pure metabolic thing or depression or anxiety, whatever brings them to that. They're invested in it and they're doing it. So this is a very different kind of medicine. It is not the traditional, here it is, see you. It involves a lot more attention, a lot more willingness to be responsive, a lot more use of wearables. So what's really cool is now that people have wearables, they can give us their data. Now that everybody has a cell phone, they can take a food photo journal and we can see their food. So it's just it's very fun. I have to say, like, as a practitioner, this is the most fun I've had in my whole career. But I also am really seeing people do better. And then what happens, like you were saying, Bitten, is it's the mom who says, "Oh, my daughter." And it's the dad who says, "You know what? Like, my wife wasn't helping me with this, but now she's helping. Now she wants to do it. Can she come and join?" So in my practice, one of the things that we have is we have a Zoom group that we call the collective. It's a fancy little word. It's really the Zoom group for the families of patients. And what I say is, come to our group. Your so-and-so, your loved one, is part of our treatment, is getting treatment with us. Come so that you fight with us instead of fight with them. Come so that you bring your questions to us instead of like niggling back in the background and like talking in their ear about, maybe you shouldn't be eating this or shouldn't be eating that. So we've tried to kind of think about what our patients actually face. What do they face in their real lives that might be standing in their way of doing this successfully? So we're bringing in those pieces to make it a really successful journey.
That
So
is fantastic. And I think what just comes up for me just so strongly with both of you and how you practice is empathy. And you cannot be empathetic without knowledge. And as medical practitioners, all of us are traditionally trained. I never got a second taught to me. I mean, yes, I had empathy taught in other ways, beautiful ways of, where's the patient coming from? Do they understand why they must take their pills? But to understand really and to let, as you said, Bitten, to meet the patient where they're at. You must be able to meet them, and to be open, like you said, Laurie, to open to what is the cutting edge at the moment, and to go, hang on, I need to keep learning, and to be open enough. So empathy for me, number one. And the other thing you said, Bitten, is that it would take 17 years to change, and that's why we developed Nutrition Network, because I'm a very impatient person, and like you're seeing change within a week, and then 2 weeks, and then 6 weeks, and you're seeing a whole new person emerge. And then we realize that this is happening in little areas all over the world. And so in Nutrition Network and our partners around the world, we're seeing that change happening in less than 17 years. So hopefully the change that we're making, today is impactful. But the story, Laurie, you were talking about how difficult it is, or the challenge of where the family's at. And I think when it comes to habits, or not habit, but a disease, a brain disease of sugar addiction, just to bring Bitten into this. Bitten, how difficult is it to convince, firstly, not just your patients, but your medical colleagues, that sugar addiction is
Martina,
real?
oh, oh my goodness, you should have heard what I've said through the years. I shook my head. I used to joke and say, I like to catch every doctor and nurse in Sweden and put them on an isolated island and force feed them knowledge. And they couldn't leave until they took an exam where they understood these things. That's my joke. And and also the problem that here it is the social system that is responsible for alcohol, pills, and drugs, and they don't see that addiction is a brain illness. So they don't use these methods. So they're even further away. The medical field don't want to work with addiction. In the psychiatric units here, they say we don't meet addicts. We send them to the social office. So it's really horrible in that way. But I thought about, what you were getting into, what I think is one of my favorite topics is motivation and compliance. How do we help clients stay motivated? And how do we help increase compliance? And that means getting the family on board. But also, I always worked with live groups, people in a room for 4 days, morning to evening for 4 days, to really, really teach all the aspects of this, and very much into relapse prevention, because that is the trick when they come out of there, and to create a community, and then create support groups where they connect with each other. That's not the professional group, it is the support group. And I thought about what you said, Laurie, which is so important, is the identification with other clients. Because it always amazes me when they come in and they listen to, I get them off start sharing, and they feel shame, they are terrified. But I always have one that is very open-minded and spoken. So I start with that one. Tell your story. And they go, ugh. And then everybody looked terrified and shocked. And they said, you talk about me and you talk about me. I thought I was the only one doing these things. And then, the bubble is burst, and they start sharing those horrible secrets, how they stole from the kids or ate junk out of the garbage can after they threw it, and all these things we addicts have done. So I think those are to relieve the shame and talk about the stigma. And then one thing all my clients say when they go home, they call me later when we have the follow-up groups. my family don't understand me. My family don't understand me. And they are very obsessed with that. And I said, well, why do you care? Do you understand this? Yeah, I understand this now. Okay, so let's start with you. Walk the walk. Keep walking the walk. But the support to walk the walk, you do with your peers. You know, your family. And we use tools like we teach the family, but we say to the family, well, you're not in treatment at my place, so you can eat whatever you want. But one thing, your home is a safe zone. So if your loved one come home, you have a cat, and they have they will go into allergenic shock. If you keep the cat, would you get rid of the cat or the wife? You know, I try to use some humor in this, and that no, of course, no, we have to, give the cat to somebody else. I said, fine, this is the same thing. So you can eat anything you want outside the house, but no junk food in the home, no sugars in the house. Your loved ones has to have a safe zone. So that's one of the tools, but we use many of these tools when we talk to the family and we make the family curious. You know the old saying, you can take a horse to water, and you can't make it drink, but you can make it very thirsty. So that's the trick. That's what we try to do with the family, not criticizing them for what they eat, but said, are you interested to learn about your brain? Is there anything you would improve? Come and listen to us. So that's how we try. And I use a lot of communication tools, spiritual tools, and great gratitude list, and a whole box of all these things. And the fun thing, when parents go home to their teenagers, they said, Mom, what you doing? Well, this is a practice I learned at the training. Show me. And the teenage kids say, can we do the communication tool tonight, Mom? Simple practices. Could we do the gratitude list together? You start just, showing. There's one thing I wanted to mention that we talked about a little bit earlier, just to make sure, this is something I'm going to talk about, withdrawal.
Mhm.
So many of my clients ended up in the emergency room with a panic attack, and it was withdrawal. It wasn't panic anxiety. It
So it's
was
withdrawal from
withdrawal
sugar.
from sugar and flour, because these clients eat huge amounts. And then one day, addicts are black and white. So then one day they say, I quit right now. And they go cold turkey. 3 days later, in the emergency room with a panic attack.
Hmm.
So that's very common. I just wanted to point that out.
So I want to mention, thank you for that, Bitten. I know your work, and Laurie, I know your work, and we sort of singing to the choir. But for those who are new to this field, I want to sort of reiterate that the only way we can fight the traditional dogma that's stuck in the past is with science. And so I want to highlight that everything that we talk and teach through Nutrition Network is backed by science. So using that, Bitten, just to put you on the spot, if you had a patient come to you saying, but how can sugar cause my anxiety and depression? How can you prove it? How would you explain that to them? I know it's a huge topic, but just in a nutshell.
Well, I don't slam 30 science articles in their head, because at that time they have foggy brain and they can't even read it. But, I start talking about common things like insulin, the cell, mitochondria. I draw a picture of the brain. I draw it together with them. Have you heard about this? Do you understand this? What is a synapse? What is a neuron? What is the fatty acid membrane? The myelin. I start talking very simple things. And I thought, all of this you can read more about, but this is how it's connected. So when things end up in our stomach, and I talk about hydrochloric acid in my stomach, and how it breaks down food, and how it goes down in the intestine, And I jokingly said, there's more bacteria in your intestine than there's cell in your body. Did you know that? No. So who is host to who? I use a lot of, humor and simple language. And I think many times people talk above the head of the client. They are not with them. And I ask, did you know that? And then the clients start telling me things they know. I read about insulin. What is that? I read about dopamine. Okay, now we can draw a picture. So that's how I start. And then I refer to science because we have many, many years of science on sugar, on neurotransmitters. And I happen to work with Professor Jürgen Engel, a researcher, is now retired. He taught me tremendous amount of, the reward system and all the neurotransmitters. So I tell them about that and I draw a picture. That's how I do it. So I make sure I see they are connected. When they glaze over, I stop. And I said, oh, enough for today. And so that's how I do it. And of course, now we have your science book. So I can take it and I can open it and show, here is the science if you want to read it.
Yeah.
But that's what I learned early on, that I have to explain science in plain language. Otherwise, I lose them.
Absolutely. Thank you. And I love that both of you spoke about educating your patients, because that is something that is core to my belief. Traditionally, as a doctor, as a nurse, as a healthcare provider, you're taught to diagnose, to manage the patient. And there's really, I think you were saying, Lori, that you've got 12 minutes. I can't remember who said that there's such a short period of time to see that client. So it depends. And so bringing it back, so a similar question to what I asked Bitten, we have people coming into an office of a psychiatrist knowing that there's a pill for this and I'm going to get relief. And yes, I have a few weeks that it might take some time for the pill to work, but I'm going to get relief. And it's really quite difficult to switch to, actually, it's going to be a little bit more difficult in the short term to change your behavior, to your practice. What do you say? You educate your patients a lot. How do you, I know you've mentioned already the beautiful way that you explain it. What if I could give you something that could increase your energy? How do you explain to somebody who wants to know the science behind why this eating the way they do eat, which is not really mapped out and just, is causing their anxiety and depression, and how this new way of eating, ketogenic, is going to revitalize them and take all the diseases away?
Sometimes I start with talking about the bidirectionality of metabolic disease with um, psychiatric disorders. So the bidirectionality of what they are already aware of and complaining about. So if in a patient who has both metabolic disease and depression or anxiety or bipolar disorder, I might say, and start with, there is a very strong connection that we know across the world in epidemiologic studies and in scientific studies, showing a link between one and the other for you, and I'll pull out theirs. Sometimes, and I can go back to that in a second. Sometimes I just start with saying, we actually know on a cellular level that the way we were thinking about things for a long, long time was wrong. We know that what we learned about serotonin and dopamine and the hypotheses that we put forth, they were all well-intentioned, but they're not correct. What we know now is that there is a huge problem that's happened as we as humans have become more and more and more hypervigilant. So let's say that starts at birth. Let's say that starts because you've got an underlying tendency for anxiety or social anxiety or something that's genetic, or that starts early, or that you start having panic attacks in childhood. And then what happens is hypervigilance develops around your body, around how you're perceived, around the chaos in your home from your alcoholic father, around being bullied, around loss, around being depressed and not managing, around having ADHD and not being able to like focus and operate. As every little bit of change makes you more and more hypervigilant, it opens up the blood-brain barrier. We know this to be true, and we know that what floods into your brain are inflammatory factors, the good ones, the good guys that are fighting. As they get into the brain, they prune your beautiful trees. Every dendrite, like they prune those beautiful trees. So inflammatory factors play a huge role in creating something that then becomes stuck. So you lose energy, interest, enthusiasm, flexibility. You lose. And you might still be able to put one foot in front of the other, but words slide off of you like Teflon. And it's why it's one of the reasons that psychotherapy doesn't work. If we could figure out a way to get those branches to regrow, you would have more flexibility of thought. You would have the opportunity to change. One of the things that helps those branches grow is brain-derived neurotrophic factor, BDNF. And when we think about how do we get that stuff then? What do we do to like get that stuff? One of the ways in very naturally that that happened to you before birth, like while you were in utero, is ketosis can actually turn on and facilitate your own body's innate ability to create brain-derived neurotrophic factor. And it does all these other things I'll tell you about later, like Bitten says, how we, but if we could get you to suddenly actually like start producing fertilizer that would allow brain cells to actually create new branches, those branches all start touching each other, those pathways connect. Suddenly, a lot of symptoms that seemed insurmountable actually diminish, and I can show you that. So if they want to see more science, we go through that. But the whole idea sometimes is in the bidirectionality part, sometimes it's in this very much of a science part. What I tell them is I don't know of a pill that I could give them that would do the same thing. Because there isn't a pill that turns on BDNF.
Yeah.
But your body can. Your body knows how to do it. It wants to do it. And if we can get that system going, and if it can outrun for just a little while the hypervigilance, the stressors that are pruning you down, you actually can begin to flourish in a way that hasn't happened before. And so one of the things that we published in this little new case series that I put out was data about flourishing, data about self-compassion, data about the things that you don't think will improve necessarily. You're not looking for them to improve when you just want your depression to go away. But guess what? You get more compassionate towards yourself. When you want your anxiety to go away, your life starts flourishing in ways that show connectedness to others. That's pretty exciting. That's exciting new work, and it's tied to what your ketone levels are and what your glucose ketone index is and sort of where you are on this ketosis journey. So super exciting.
This is so exciting because I think, there are just so many people. I mean, you can count on your hands the number of people who are suffering with anxiety and depression. Every second person, maybe more. And to be able to, like both of you are changing lives and going from chronic disease to people who are flourishing, who are no longer patients, but are able to just flourish in their lives. And you've given us so much already. You've given us so much hope. And I love it because we're living in the age of burnout, where medical professionals, and I experienced it myself, just trying to help too much and having too much disease and not having the answers quick enough. And now we are through this also giving medical professionals hope and enjoyment of this art and science that we've studied together so that we can actually help people and first do no harm. So I want to thank both of you. It's just such an exciting topic. I can't wait for everybody to see what you and to learn from you and to change their practices and bring this hope to the rest of the world. Thank you so much. And it's so lovely to have you both on.
Thank you very much. The same to both of you. Okay.
Yes, 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 to both of you. Thank
So,
you. Stay well.
bye-bye.